Welcome, everybody. I'm Marla with Nine Health. Thank you for joining us this morning. And we are lucky to be joined today by our own Dr. Coley. Thank you for joining us, as well as Eric Peri from the COVID Check. He's Colorado, knows a lot about these testing sites. And so, the holiday season is upon us, and we are all wondering how can we enjoy the festivities, if we can enjoy the festivities and do it safely this year. And so wondering if testing can be a part of that. And we wanted to talk to our experts here to find out what we can do to stay safe this holiday season, and if testing can help us do that. And so I'm eager to find out the answers, and I know you guys all have them. And Nine Health has partnered with COVID Check Colorado to be able to offer this free, reliable testing to everybody, no matter what. And I have done this testing, and I can tell you about it in a minute, but I want to jump right into it. And Dr. Coley, can you just give us the overview right now? I mean, COVID cases are going down slightly, but is that really any room for comfort? Or tell us what the scene is.
Yeah, we are seeing this, Marla. We're seeing the COVID cases going down, but in my opinion, that is a reflection of the fact that we're under testing. So testing has really been the Achilles heel of this pandemic from the beginning. And even several months later, I feel like we're in the same position. The WHO says that we should be testing about 2% of our entire population every day. So that means, well over 100,000 tests a day. And what we're doing is about a third to about a half as much. So I'm really excited for COVID Check to be offering this testing option, because I think the community testing sites have had their challenges because of the weather, because of staffing issues, because of, other things creating bottlenecks. And I think the cases going down is merely a reflection of the fact that people are frustrated. They're not getting tested as much as they should. And I could count, probably 10 or 15 cases just this week of patients who called me and said that they were exposed to somebody, but they don't have the time off of work to go wait in line for 5 hours to go get tested or what have you. So I don't think we should quite take comfort in the fact that the cases are going down, because obviously the exposures have gone up. The cold weather is going to facilitate the spread. And the data tells us that the actual number of cases is about 4 to 7 times as many as we are detecting with our current state of testing.
Wow, that's a lot. So thanks for sharing that. I do think that testing is, I've heard that too, that it can take forever, and, you have to stand in line. And Eric, you know a little bit about this with your testing sites with COVID Check Colorado. How are you guys able to manage it so that people don't have to wait so long in line, and it's a smooth process? What are you guys doing?
Well, Marla, I mean, it's really a testament to the frontline heroes that are out there at these testing sites that have made COVID Check Colorado able to deliver a service that is best in class for the folks who need it most, and up to now have had the least access. So almost all of our sites are open from 7 a.m. to 5 p.m. and we're running multiple lanes at each one. So we've got a whole crew out there that's ready to give folks the best in class care with a gold standard test and get results back to them quickly. So it's really a question of going to all the places where there have not been sites before, opening those sites for as many hours and days of the week as we can. And then we just run a tight ship. So it's in and out for folks who are coming through in usually 5 to 10 minutes. And that's even at the peak hours in the before work hours, 7 to 9, and later in the afternoon.
Yeah, so I went to the All City Stadium site, which is by South High School, and that actually is how it occurred. It was literally 5 minutes I was in, and I stayed in my car. So, and when you talk about lanes, you literally drive into a lane, and then people come out, and they're standing there, and you stay in your car. And they just do the nasal swab, which wasn't that bad. It wasn't the one that goes all the way back to your brain that I've heard. And then literally you drive away. So you're right, that was a very simple process, took probably 5 minutes. Dr. Coley, tell us a little bit about who should get tested. How do you know if you should go get tested?
Everyone should get tested. And if you haven't thus far been tested during the pandemic, that means, you're not using testing as you should. So testing is going to be one of those tools that breaks that chain of transmission. So the more testing we do, the more we're going to slow the spread of this virus. You're testing not just for yourself, but you're actually getting tested for your community as well. Now, there's a lot of people who say we should even be doing asymptomatic surveillance testing. But again, with the fact that we've had limited testing resources at this point, we've largely been focusing on those who are symptomatic. But I would say there are three main groups of people that should get tested. So the first is if you have any symptoms at all. Even if they're atypical symptoms, but of course, if they're the typical symptoms like cough, shortness of breath, loss of taste or smell, fever, chills, malaise, any of those symptoms have a very low threshold to go and get tested. And that nasal swab test that you're talking about, Marla, is the PCR test. That's really the gold standard in terms of testing. It beats the saliva test, it beats the rapid test that you see at some urgent cares, it beats the performance of a lot of other tests. The second group of people that should be tested are the ones that have had a known exposure. So if you were in close contact with somebody, meaning, less than 6 feet or greater than 15 minutes duration or both, and they test positive for COVID-19, then you're considered a close contact and you should get tested, and probably your close contact should get tested. So if your significant other, for example, was exposed to somebody with COVID-19 and, you share a house, you share a bed, you share a bathroom, both of you should go and get tested. And then the third group that should get tested is those that are high risk for exposure. So these are the people that I'm talking about. We should be doing that asymptomatic surveillance testing in. I know that even amongst healthcare workers, this doesn't happen nearly as often as it should, again, because of the lack of testing resources. But to really get a sense of what this virus is doing in the community, we have to start doing this because we know that up to 40% of cases can be asymptomatic. And it's those asymptomatic people that are feeling well that are the highest risk for spreading this infection to others.
Yeah, that's right. And you just don't know who's going to be asymptomatic. And when you've come in contact with people, how safe are you if you're wearing your mask, if you're doing what you're supposed to be doing, wearing your mask and social distancing? How safe are you?
Yeah, the CDC has said that wearing the mask not only, of course, protects, your neighbor or somebody else from your droplets, but in fact, it also protects you from their droplets. So it's a barrier protection. And those double layer cotton masks that we're talking about have reasonably good efficacy. Of course, those N95s have even better efficacy if you had a face shield on top of that. On top of your mask, that's kind of the best way to protect yourself. But if both parties are wearing a mask, even if one party is infected, the risk of transmission goes dramatically down. So, masks, I really feel like need to become a little bit of a culture shift for us because even after the vaccine comes, there's so many benefits to those masks. In fact, the rate of flu activity this year has only been 0.1% reported in some weeks because of those masks. People are having less colds, people are feeling healthier in general. So they really have served a lot of good purposes. But I want to make one more point about testing that relates to the holidays, which is that as the holidays are coming, of course, the official guidance of the CDC is that we shouldn't gather and we shouldn't travel. But if you choose to do that, you can really use testing as a way to reduce your risk and reduce the risk of others and to mitigate the risks of gathering and traveling. So, testing essentially resets the clock on your exposure. So let's say that you wanted to try to see somebody on Christmas. The best strategy would be for you and that person to both quarantine for 14 days. And I mean a strict quarantine, not leaving your home, and then you can safely gather without necessarily worrying about exposing each other. Now, of course, we're less than 14 days away from Christmas. And so if you haven't done that, testing can help you facilitate that by essentially shortening that clock. So if you go and get tested today and then start quarantining and then get tested again right before Christmas, and both of those tests are negative and you haven't had any new exposures, you can again feel quite confident that you're not inadvertently going to expose somebody else.
Yeah,
I would
that's
just
a
chime
great
in.
point. Yeah,
Oh,
go
sorry,
ahead.
Marla. I would just chime in and echo Dr. Coley there that, if you come to a COVID Check Colorado site, you can schedule your appointment online or on your phone, quickly get to one. You could get a test on Monday, the 21st, and you'd have your results back in many cases Tuesday or Wednesday, which would lead you into the holidays with that sense of security that, you're not bringing COVID home for the holidays. You're just bringing yourself.
Yeah, no, that's a great point because I think sometimes we also think that getting a test, then you have to wait a long time to get your results. So if you get tested by the 21st, you could then get your results at least by the 24th. So,
One of the things I wanted to add to, Marla, was just that I think the testing missteps are the reason this got so far out of hand. Because you look at countries like South Korea, it wasn't just how much testing, but it was how quickly, to Eric's point, point are we getting those results, and how quickly are we able to act upon those results? And again, I think this kind of a service where you can get in and out in 5 or 10 minutes and get your results back within a day or two, it's going to be incredible in terms of slowing down the spread of this virus until we all get vaccinated.
Yeah, that's a great point too. And I think this is what you guys are talking about is so important because, Michelle says in the comments that you celebrate Christmas just like you do any other year, pandemic or not. Families need to be together, and there is that sentiment out there. And so what you're saying is there are some safer ways to do it, and as you just described. What would you say though to people who say, we're just going to gather no matter what?
I would say that this is not like any other year, Michelle. It is dramatically different, and we have over 3,000 Americans dying every single day. And what you have to realize is your decision to gather is not just going to affect you, it's going to affect your loved ones, potentially in a very bad way, and it's going to affect the rest of the community. So as Marla said, we know that there's an emotional urge for us to see our loved ones in the holidays. We know it's been a tough year. Some of us really want to see other people, for whatever reason, but that's why we use strategies to try to mitigate and reduce that risk. And those are strategies like quarantining, like testing. When you see somebody, wear a mask around them. If you want to gather indoors with your friends or family, keep that distance, wear that mask, and try to make it as safe as possible for you to gather.
Yeah, there are some things we can do to be safer and still see our families, because I do think that there are risks with not seeing our families too, mental health risks and other things. And Eric, you guys are helping, and 9Health has partnered with the COVID Check Colorado to make sure people can get to some of those resources. How do you find a location that's near you, and where are your locations? Are they across the state or are they localized? So tell us a little bit about that.
Yeah, Marla, it's quite simple. Anyone who wants a test can get one quickly by going to covidcheckcolorado.org. And we're trying to persuade folks to Dr. Coley's point, to get this testing done before the holidays. Monday, we've branded it as Crush COVID Monday. And the idea is we want to get folks out there tested Monday so they get the results back before the 24th. We've got locations all over the state, more than a dozen in the Denver metro area, all the way up to Milliken, down to Parker, west of Golden, east into Aurora, and many, many more sprinkled in between. We're also, it's worth visiting the site every day because we're popping up at locations in partnership with 9Health now, for single day testing events as well. So a quick visit to covidcheckcolorado.org will show you the sites that are open and running. Many of them are open Monday to Saturday, 7 to 5. And then we do those pop-ups as well to increase access for other parts of the community.
Yeah, Eric, I just put the covidcheckcolorado.org website in the comments. So if you're looking for that, you can find it, and it's super easy. I think 9Health is partnering to offer a site at the Ethiopian and Evangelical Church in Aurora, and then one at Crossroads Church on Monday. So those will be up on the website too, and you'll see your friendly 9Health volunteers and staff there. So, but there's other
Eric,
sites.
I was just going to say, a lot of people have been calling my office asking for a prescription to get tested. Is that something that people need for COVID Check Colorado?
I'm glad you asked, Dr. Coley, and the short and good answer is no. You don't need a prescription from a doc at the moment, because there's actually a standing order, given what Dr. Coley said about the essential nature of testing as a critical tool to fight the virus and stop the spread. Anyone who needs or wants a test right now can get one without a prior prescription. That's something that the state has put in place because we do need more testing, and if you don't have symptoms, you may very well be shedding virus and infecting others unbeknownst to you. So whether you have symptoms or no, you don't need a prescription. All you need is an appointment. And in fact, you can even show up at one of our sites without pre-registering and get a test and get registered right there on the spot. Yeah, it's easily done. No script needed. Just a quick click on covidcheckcolorado.org, and that'll get you your test and get you where you need to go.
How about health insurance?
I'm glad you asked on that front. You don't need health insurance either. Yeah, this is free and open to the public, and you don't need health insurance, and there's no identification required either. So there really shouldn't be a barrier for anyone here in any of our communities. What we want is, regardless of your immigration status, regardless of your insurance status, we want you to be able to get tested in a free, fast, and reliable fashion. And that's exactly what covidcheckcolorado.org makes possible for you.
Yeah, so great points. You don't need a prescription. You don't have to have any symptoms or been exposed. And certainly you don't need health insurance or any identification. So this is kind of the easiest, fastest way to do it. And I'm interested, I didn't know that you could drive up or walk up to a site and get tested. So that's interesting and good to know, because maybe somebody doesn't have the computer, or maybe you're just coming from work and you just decide right now you want to go. So really great point. Now, I think it's interesting too that so many of our sites, we think that they're going to be packed and it takes a long time. And so that's been true at some of the sites, but it's not true here. And you were talking about lanes. Tell us a little about how the site, what do I expect when I get to the site? What is it going to look like? What do I do?
Yeah, so I'm glad you asked, Marla. When you arrive at a COVID check site, you'll be greeted by a friendly face who gets you checked in quickly. That process usually takes just about 20-30 seconds if you have a appointment pre-scheduled. If you don't, it just takes a couple minutes to get you scheduled right there on the spot. And then, yeah, you will drive up to see our wonderful clinical staff. They'll be there in full PPE, bunny suited up with a face shield and a mask, and ready to do a quick swab. It's about 5-10 seconds on each nostril. They put that swab in a tube, and that tube gets shipped off that night to the lab, so you get your result back the next day. So it's really quick and easy. You arrive at that checkpoint, you drive through to the lane, and within 5 minutes, you're driving out the other side of the parking lot and on to the rest of your day.
Yeah, and should you wear your mask and when you go and talk about how to prepare maybe?
Yeah, that's really all there is to it. Whether you're walking up or driving up, you should come masked up as well. And we also have, if you don't have a mask, we have masks, right there on site that we can hand over. But best to show up in a mask with confirmation of your appointment. If you have one ahead of time, it can be right there on your phone. And if you don't, just a readiness to get checked in there on site. That's
great. That's great. And Dr. Kohler, remind us kind of what we do if we are positive. So we go get tested and we find out that we're positive. And then I'm gonna test you with my particular circumstance too.
So I think two things really to think about is if you're positive, what are the implications for you and what are the implications for others? So for you, obviously, you want to think about how you're doing. So I would recommend having a blood pressure cuff, a pulse oximeter, having some Tylenol on hand, some cough syrup, having a way to get food delivered to your house, knowing where you would go if you needed to, be hospitalized or seek a higher level of care. The pulse oximeter allows you to check your oxygen levels at home. Sometimes that can sneak up on us, and any oxygen level below 93% should really, you should bring to the attention of your healthcare provider, because it could be a sign that you're decompensating. You want to be checking your fever, you want to be checking your blood pressure, and then staying hydrated, trying to keep it light on the food, just like we do when we have the flu. So those are kind of the things to do for you. Then you have to think about the things to do for others. So the first thing I would do is really kind of make a list of contacts in your head. In the last 5 days before your symptoms started, who did you come into contact with? Because you need to alert those people that you've tested positive, because they may then need to go and get a test or may themselves be symptomatic and infected with the virus. You also need to think about how to protect those people that you live with at the time. So you want to really try to stay within one room, use one dedicated bathroom, wear a mask, of course, when you come into contact with anyone. Keep your pets away from you, because there has been, obviously some coronavirus in animals that we've seen. We have not seen human to animal transmission yet. We've only seen animal to animal, but again, it's a theoretical possibility. So you do want to protect your pets. And then you want to, of course, try to minimize leaving the house from that point forward, until at least about 10 days or your symptoms resolve, or both, ideally, because you don't want to expose anyone further.
Okay.
And I would just echo Dr. Coley here. One of the things we're really proud to offer as part of the COVID check service is that anyone who does test positive gets a follow-up call from a doctor or nurse here in Colorado who can walk them through that same set of steps that Dr. Coley just named. So, and that comes free of charge and is offered in both English and Spanish. So that follow-up care and support is available to anyone who comes through one of our COVID check sites.
That's great, because I was just going to say that's a lot to remember.
Well, it's funny. I call it my COVID preparation kit. And I forgot the most important part, which is something fun to do, because you're going to be stuck by yourself in a space for about 10 days or so. So you want to have movies, or your laptop, or books, or puzzles, whatever it is that you like to do to pass the time, because you really want to try to stay in that room and not expose others.
Yeah. So in my particular case, someone in my household did test positive, and then I tested negative twice, but someone else in my household tested positive just Tuesday. And so, you know, for me, I'm wondering, what do I do? Do I now have to quarantine another 14 days or 10 days? Or, you know, what, in my particular situation, what would you recommend?
So the CDC has now revised their guidelines, and they essentially, it used to be 14 days for the full quarantine, and now they've said after exposure you can do 10 days with a negative test. So here again is another situation where you can use that negative test in order to try to mitigate your risk. Now, you don't want to get tested on the day that you're exposed. So let's say you got exposed on a Monday, you really don't want to go on Monday or Tuesday to get tested, because it's too soon after exposure. The virus really hasn't built up in your body, so you may get a false negative test. So you really want to try to go about 3 to 5 days, ideally about 5 days. That's the average incubation period of the virus, assuming you're not having symptoms. If you develop symptoms, obviously you go earlier. But anytime there's a new positive COVID test and exposure, it really does reset that clock, Marla. But now that clock can be a little bit shortened based on what the CDC is telling us, with that negative test.
So would I get tested again in 5 more days, do you think?
Yeah, so if you had a new exposure to a new person that tested positive, then yes, you get tested again in 5 more days. Now, if you think it's the same exposure, meaning that other person in your household got infected from that third person in your household, then you may not necessarily need to get tested again. So it's a little bit tricky. It starts to become nuanced. I also want to remind everybody that so do you think it was the person A, we call it the proband, who infected person B and now is exposing you, person C?
Yes.
Yes. Well, in that case, it's not considered a new exposure because you've already technically been exposed to person A. So your clock really starts when you first exposed to person A, not necessarily to person B. But I think this brings up an interesting point, which is that, remember, for COVID, it's a very different disease than the flu in the sense that, 10% of people are responsible for 80% of the spread. And these are what we call the super spreaders. So it means that not all of us are shedding the virus, even when we're infected. But there's a small subset there are, and we just don't know beforehand how to tell who those people are. So, it is entirely possible for you to be in a household with somebody else and still not test positive, because it's possible that that person's not shedding. Now, in this case, in your case, Marla, since that person probably infected person B, I suspect that they may be shedding, or person B may be shedding. So I would, urge, of course, the utmost caution and urge you to keep your distance as much as possible and use testing frequently, again, in about 5 days, just to see if anything has changed.
Yep. Don't worry. I won't leave the house, and I'm going to go back and get tested. So.
And I'm sorry to hear that. That's a lot you're going through.
Yeah, I think it just describes what we're all going through right now. And why testing can really help us. I mean, this is helping me understand what I need to do and how to keep other people safe. And so I appreciate you're going through it, and hopefully it can help other people see how they need to also use testing and isolate. Is it isolation or quarantine that I'm doing?
So isolation is if you're sick. Quarantine is if you have no symptoms.
Yeah, so the quarantine that I'm doing. So thank you for going through all that, and hopefully it's helpful to other people too. And Eric, thank you for offering these testing sites. We put the link to the sites in the Facebook feed, and we really appreciate all this effort that you and 9Health are doing to make sure that people can get these tests that are so critical to helping us control this disease. Thank you, Dr. Coley, for helping us understand it all. And please, if you still do have questions, you can post them in the comments and we'll try and get those answered for you. But thank you so much. I'm going to let you guys go and appreciate all of your wisdom.
Thanks so much, Marla. Really appreciate the opportunity.
Thank you.